heart is a pump. It's a muscular organ about the size of your fist and is located slightly left of center in your chest. Your heart is divided into the right and left side. The division protects oxygen-rich blood from mixing with oxygen-poor blood. Together, your heart and blood vessels comprise your cardiovascular system, which circulates blood and oxygen around your body. In fact, your heart pumps about 5 quarts of blood every minute, and it beats about 100,000 times in one day. That's about 35 million times in a year. Oxygen-poor blood, blue blood, returns to the heart after circulating through your body. The right side of the heart, composed of the right atrium and ventricle, collects and pumps the blood to the lungs through the pulmonary arteries. The lungs refresh the blood with a new supply of oxygen, making it turn red. Oxygen-rich blood, red blood, then enters the left side of the heart, composed of the left atrium and ventricle, and is pumped through the aorta to the body to supply tissues with oxygen. 4 valves within your heart keep your blood moving the right way. The tricuspid, mitral, pulmonary, and aortic valves work like gates on a fence. They open only one way and only when pushed on. Each valve opens and closes once per heartbeat, or about once every second. A beating heart contracts and relaxes. Contraction is called systole, and relaxing is called diastole. During systole, your ventricles contract, forcing blood into the vessels going to your lungs and body, much like ketchup being forced out of a squeeze bottle. The right ventricle contracts a little bit before the left ventricle does. Your ventricles then relax during diastole and are filled with blood coming from the upper chambers, the left and right atria. Then the cycle starts over again.
Okay, so cholesterol is a waxy substance in the blood. We need it to make healthy blood cells. Lifestyle factors can influence your cholesterol, so you can have high cholesterol or normal cholesterol. High cholesterol can be inherited, and you can tell by getting your blood drawn, and the blood test will show if you have high cholesterol or not. Multiple lifestyle factors that play into cholesterol is if you eat a lot of processed sugary foods, lack of exercise. So to prevent high cholesterol, don't eat a lot of fast food, processed foods, work out regularly, you want to get your blood flowing in your heart. If you do have high cholesterol, you can be put on medicine to help lower it. But high cholesterol basically builds up in your arteries and prevents blood from flowing. There's LDL and HDL cholesterol, so it's bad versus good cholesterol. Low density lipoprotein is the bad cholesterol. It builds up in the arteries and prevents blood flow. And then HDL is good cholesterol, and it picks up excess cholesterol or bad cholesterol and takes it down to the liver. Some complications of high cholesterol would be stroke and heart attack.
So I did coronary artery disease, and that's where cholesterol builds up in your arteries, and then over time it'll create a blockage in your blood flow, and so oxygen can't get to your heart, and that would create a heart attack. Some symptoms from that could be chest pain or tightness, and feel like someone is standing on top of your chest. Over time this will happen. It's not all at once. And then also you'll have shortness of breath, extreme fatigue when doing any type of exercise, not even working out, just walking around. And then to help prevent this, you have to do some major life changes. So don't smoke, just reduce your stress, keep your cholesterol and high blood pressure down, and then also eating healthier instead of having fast food all the time, just to watch how much the cholesterol and plaque will build up. And then some treatments for this, if it does get to that point, are you can do coronary bypass, and that's where they use a graft from another vessel in your body, and it'll either have the blood flow around the blocked artery. You can also use supplements to help not get to that point. And you can eating fish and just doing fish oil supplements to help with the fatty acids to reduce the inflammation so your arteries don't get inflamed. And then also you can do eat artichoke, cocoa, oat bran, garlic supplements. Those all help with your high blood pressure and your high cholesterol to keep it down.
I'm going to talk about cardiovascular disease, which is just refers to the number of conditions that have to do with the heart and the surrounding blood vessels. Most of these conditions are caused by atherosclerosis, which is just that plaque buildup in the arteries, causing blood clots, which will lead to the heart attack and stroke. The heart attack specifically is where the blood gets cut off by the clot, and that part of the heart muscle that's supplied by the artery will die. And then stroke, there are two different kinds. There's the ischemic stroke, which is the most common, where just cells die due to the blockage. And then there's the hemorrhagic stroke, which is where like the blood vessel will burst. Also related to cardiovascular disease is arrhythmia, which is just the different abnormal beating of your heart, which can actually cause the heart to not be able to pump enough blood. There are two different kinds of arrhythmia, which is bradycardia, where the heart rate is too slow, which is less than 60 beats per minute, and tachycardia, which the heart rate is too fast, or more than 100 beats per minute.
All right, so congestive heart failure is when blood is not being pumped to the body to the sufficient amount, and that comes with narrowed arteries, that comes from plaque buildup. And from there, as I said earlier, problems pumping blood because the heart becomes too weak or too stiff. And from there, we have some symptoms of someone who may have congestive heart failure, mainly fatigue because blood isn't flowing to the muscles, and from there, obviously, you don't have a lot of energy. Also, with that, you have some nausea, and that comes from not a lot of blood getting to the brain. And a couple of other examples of that would be like shortness of breath, which would come from not getting to the lungs, and arrhythmia. And complications obviously arise from this, namely kidney damage or failure, and that's just from just not a lot of circulation. And same goes for the liver. And yeah, circulation is the main problem that comes from this and is why it should be avoided.
So heart disease is the leading cause of death in the United States, and there are several things that can lead to a higher risk of heart disease, and these are called risk factors. There's two different types of risk factors. There's ones that you can't change, and there's ones that you can help prevent. The ones that you can't change include age, gender, race, and family history, which all could lead to a higher chance of heart disease, which you really don't have a way of preventing. But then there's also risk factors that you can help prevent. Some of these include monitoring your blood pressure, getting it checked regularly, and then if you're having issues with your blood pressure, you can make lifestyle changes that can help improve it. And then also it's good to monitor your cholesterol and your triglyceride levels and keeping them under control. Also, lifestyle changes can help lower these levels, and there's also certain medications that can help lower these as well. Other things include a healthy weight, a diet, exercise, limiting on your alcohol consumption, your smoking, and then also managing your stress and diabetes, and making sure you get enough sleep every night.